So finally we are here with the last lecture of child psychiatry series, and this lecture is not related to neurodevelopmental disorders. The title of the lecture initially was Attachment Disorders of the Childhood, but once I went to this topic from 2-3 textbooks, I found that it's not a long topic, rather it's a short topic. So I would like to cover childhood PTSD along with it, but as I mentioned that disorders of adult psychiatry in child, we shall be covering only the differences from adults, only the differences from adults. But I wish to cover a few topics of child psychology from examination point of view, if at all I get time. So without wasting any time, shall we start? Because I have 2 hours and this is the topic lineup for the day. First of all, trauma and stress related disorders. In adults, we divide them into after a major trauma, after a minor trauma, or routine life stress. In adult psychiatry, we divide them into adjustment disorder on the one side and acute stress and PTSD on the one side. But in childhood, we divide them into reactive attachment disorders, disinhibited social engagement disorder, and PTSD in children. This is the latest DSM-5 classification of trauma and stress related disorders in children. Good evening Anupama, Shamini, Sundramurthy. Good evening Adarshna, Krishnendu, hello. So all are set for the last lecture. Many of you are already in module 2. So by this time all people are settled. I wish to share with you that this week we are celebrating DAMS 21st year anniversary. It is year 2021 and DAMS was started in the year 2000 by my director, my professor, my mentor, my elder brother, anybody you can say, Dr. Sumer Sethi. At that time he was doing post-graduation in radiology from Lady Hardinge Medical College, and this is the year when DAMS started. I know Dr. Sumer from my second MBBS, that is 2006-07 that days. So I know him for the last approximately 14-15 years. So couple of years I was in DAMS as a student, and for like 7 years I am in as a faculty from 2014-15. So very proud moment for all, and we are celebrating this with some discount offers which I have already shared with you. So I wanted to tell you all this. In the meantime, you all are settled. So trauma and stress related disorders, and this year we have started resident teaching for the first time. You all know this, and we have got tremendous response specifically in OBGY and psychiatry, thanks to you all. I have 500 plus, in both modules combined, people listening. Medicine, we have got very good response, thanks to all of you, and we'll be covering more and more topics of residents in near future, but not now, because I have seen in the WhatsApp group that some of you are asking for many more topics because probably you are enjoying the teaching. So, but practically, let me finish what all topics I have committed, then I'll go ahead with other disorders if possible. Yes, settled? Alright. Good evening Ankita, Nishan, Shubham, hello. Thanks Lakshmi. Okay, so this is DSM-5 classification. In DSM-4, these two were together. Okay, in DSM-4, these two were together. Actually, the previous classification was, you can say this is a new term in DSM-5, because the previous classification was RAD, reactive attachment disorder. Two subtypes were given. Emotionally withdrawn type and indiscriminately socially disinhibited type. You know, some examiners or some books would still give you RAD as per old terminology. Okay, let me once again tell you, reactive attachment disorder was of two types, emotionally withdrawn type and indiscriminately socially disinhibited type. These were two distinct disorders. Now what they have said that reactive attachment disorder, emotionally withdrawn type is reactive attachment disorder in DSM-5, and is indiscriminately socially disinhibited type is disinhibited social engagement disorder. Do you understand the classification? पहले आरएडी के ही दो टाइप थे, एक विड्रॉन वाला, एक डिसइनहिबिटेड वाला. अब विड्रॉन वाले को आरएडी कह दिया और डिसइनहिबिटेड वाले को सेपरेट डिसऑर्डर बना दिया गया है. डू यू अंडरस्टैंड दिस? रिस्पॉन्ड प्लीज. Before I take you further, let me give you a conceptualization of this disorder. These disorders, number one, are differential diagnosis of autism spectrum disorder. Autism has decreased attachment to parents and others, but these disorders have decreased attachment mainly to the parents. To others, it's not that much affected, the social relatedness. So as you can understand, they have problem with the parents. So this disorder is related to pathologically caretaking. So caretaker pathology, this disorder is related to. So more seen in children in adoption homes, in the foster care, more seen in children with changing caregiver, more seen in children who have a pathological attachment. Before we talk about attachment disorders, I want to know, do you have a concept of attachment theory? Do you have the first attachment theory was given by John Bowlby. Okay, I'm not going into details of John Bowlby concept, Mary Ainsworth concept, Donald Winnicott concept of transitional object or love object, or I'm not going into theory, but at least gross idea of attachment you have. So taking to the background of all this, attachment can be a secure attachment, can be an insecure attachment, can be a disorganized attachment. Do you people have this idea? I'm not going into attachment theory is itself a psychology topic. I was discussing on the WhatsApp group today. I think by now all of you are in the WhatsApp group because we are in the last lecture. If still someone is not there, please join. So I was discussing with the WhatsApp group. Rachit was there, I guess, and few others were there, Divya and all. I was talking that psychology topics, they deserve more of teaching and they deserve more of explanations. So attachment theory is a psychology topic because that's a normal human behavior. Attachment disorder is a child psychiatry topic, that is disorder. So first let's speak about a little bit, not too much details, but about the attachment theory. Have you ever read about attachment theory? How does the child establishes attachment bonding? Secure attachment is when the parent is available. Insecure attachment is when the caregivers are not available. I am making it gross. It is not as simple as I am making it. Just grossly I am giving you an idea. Disorganized attachment is in which the child needs proximity to the caregiver. He wants to be close, but has apprehension in approaching caregiver. This is the gross attachment concept. So when there is a secure attachment, the child has available, it's not only physical available, it is emotional availability. Parent or the caregiver is available emotionally whenever the child needs help. So it makes the children well adjusted and more exploratory. And these type of attachments lead to pathological caretaking. What is pathological caretaking? This is the background of this disorder. So when there is a pathological caretaking, the children develop attachment disorders.